Hi, everyone. It's so nice to see you. I hope you can hear me. So if you wanted to put it in the chat, tell me whether you can hear me and see my screen as well. And then also what some of your biggest challenges are with your animals when it comes to gut health. Hello from Kansas, Ohio. Allergies and skin and coat issues. Yeah, definitely a lot of those going on. Oh, from Indonesia. Wow. Thank you so much for joining from so far away. You must have taken a really long trip. Anyways, it's so nice to see you all. Netherlands, wow, you're still up. Kudos to you. I don't know what time it is in Indonesia, so I can't really comment on that. But if it's the middle of the night, then thanks for being here. Oh yeah, so epilepsy, IBD, kidney disease, GERD, IBD, allergies. Kelly, my dog has IBD, PLE, and it looks like SIBO, eating cloth, diarrhea, GI issues, British Columbia. Great. Awesome. Thank you. Thank you for sharing where you're from and what some of your challenges are. Oh, Dr. Roman is in the house from Hopkinton. Thank you for being here. You're my hero. You're the one who kind of put me on the path of looking at the gut and fecal transplants and everything. So for those of you who don't know, Dr. Margot Roman, she's like the pioneer in veterinary fecal transplant microbiome restorative therapy. So what I know mostly comes from her, and she has spread the word and trained a lot of veterinarians and helped a lot of animals that way. And some of the capsules that you all get from Animal Biome, and I'll talk about that a little bit later, the raw ones come from her dogs. So really amazing. So glad you're here. Means a lot. All right, very good. So I want to get started because we have quite a bit to cover. I want to start with sharing just a little bit about who I am. I'm Dr. Odette Suter. I'm a holistic veterinarian, and because I tend to wear that poop hat just for fun, because poop is a little disgusting, diarrhea, vomiting, all those things are not the most appealing of all things. So because I do wear that hat, people have started calling me Dr. Poop Lady. So I like that. It makes me laugh. So anyways, welcome again here to the Heal Your Pet Gut Health Masterclass. In this class, I will share with you the proven strategy that I use in my practice to heal my patients' digestive tract. So because I do talk a lot about poop and I'm very passionate about it, I also have done a lot of research. And in the process, what I found, just to kind of illustrate a little bit how prevalent this issue is with gut health, I found this study that showed that 20 to 30% of vet visits are gut related, so for vomiting and diarrhea. And as you probably know, if you already have dealt with gut issues for a while, there are also a number of Facebook groups that are supporting pet parents in that department. And in my practice, I do see a lot of animals with a disturbed digestion. And that may be because I'm a little bit more known to be good at helping to heal the gastrointestinal tract. But I think it's just a common increase that's happened over the years. And I will show you a bit more about that because it's kind of obvious that a lot of things are going on this planet that are contributing to that. So also, I found that just in the first 2 weeks or 3 weeks of January, there are 27,000 new studies on that subject. So gut health is really a big deal, right? Today, I want to share with you my gut healing strategy and help you with a plan so that you also can heal your pet's gut. We'll have a closer look at the digestive tract so that everything will make more sense. I will share with you a little bit more information about the digestive tract so that you know a little bit about what we're talking about. We'll talk about the causes of poor gut health, so what is influencing the gut. We'll look at some gut-related diseases and also at common mistakes, because I do see those quite a lot, which then perpetuates the length or, extends the length of gastrointestinal issues. We'll look at some essential tests as well, and then we'll dive into the healing strategy. Okay, so this is value packed. I recommend that you turn off all the distractions, shut the door and grab a piece of paper and a pen or your computer or whatever you're using to write notes, because there will be a lot of information. I will take you on a journey to a deeper understanding of how to heal your pet's gut issues. Hippocrates, he lived in 400 BC, and he already knew that all diseases begin in the gut. So this is not really new. What happens in the gut basically then means is not really staying in the gut. And a few years back, something possessed me to Google golden poop. And this is what I found, a golden poo on a royal red pillow. And what I found is that in Japan, this golden poo symbolizes good luck. I've also seen it in association with some Asian restaurants as a symbol of their food being healthy for digestion. The gut is connected to everything that happens in the whole body and is at the root of all of the diseases that we see commonly. So here are just a few diseases that are linked to the gastrointestinal tract. Generalized inflammation, metabolic issues, being overweight, diabetes, insulin resistance, weight loss as well, back pain, recurrent stiffness, poor top line, which means the poor development of the muscles along the spine, arthritis, muscle tightness, pain, allergies, skin issues, autoimmune diseases, asthma, cancer. So those are all issues that relate to the immune system. So the gut really affects the immune system quite a bit. Hormone imbalances, and then all the different types of mood disorders that we see in our animals, such as anxiety, aggression, irritability, etc. And then also dementia, cognitive dysfunction. And those are just a few, but you can see it basically covers a lot of the different organ systems that we have in the body. And then I also pulled out a few for humans, because we are just as much affected as our animals. And so basically what I'm going to be talking about today applies to us humans just as much as it applies to the animals. So acne, chronic fatigue, autism, Parkinson's, a lot of these neurodegenerative diseases, migraines, lupus, autoimmune diseases, heart failure, etc. Anytime I see a sick patient, my brain goes right to the gut, and I assume that there is an imbalance present in the gut. So in other words, even if I don't see digestive issues like diarrhea, vomiting, reflux, abdominal pain, etc., it does not mean that the animals don't have any gut issues. And in fact, I do have a little pug patient in my practice, and she actually doesn't have any issues at all. But when we did a microbiome test on her microbiome was way off. And so we started to fix that microbiome ahead of time, because we wanted to prevent diseases down the road. So this is a very proactive client that I have. And, just to kind of emphasize this a little bit more, and you may have seen it in my newsletter, I was just in Europe, and, in Europe, they have a lot of these good bakeries with things that are just calling my name. So I ate a lot of gluten when I was there, and I didn't have any digestive symptoms, but in the evenings, I would notice that I had just a tiny bit of dizziness. I would move my head and my eyes just didn't quite follow the way they were supposed to. And so I knew that I just had set my brain on fire with that. So it doesn't necessarily mean that there is no gut issue there if there are some other issues. So we need to kind of pay attention to some of these other symptoms that are gut related as well. And for people and animals who have a lot of gut issues, their life is really down the toilet because they just don't feel well. And we have to wonder, why is it that so many pets and people alike have never-ending digestive issues when the gut lining can really fully regenerate itself in just 2 to 6 days? So we'll dive into that. But my answer to it is that we have a defective healthcare system. So not only does the conventional system not work for most of the diseases that we currently are plagued by in this modern world, which are mostly chronic diseases, but it also has indoctrinated us on how to think when it comes to health and disease. The pharmaceutical industry spends billions of dollars each year to enforce the faulty belief that there is a pill for every ill. So as a result, people are basically throwing money down the toilet, and their animals aren't really truly healing because of that. What I'm saying is not to discredit the conventional system, because we definitely need it. It has its place, but we need to start to think a little bit differently. We have this belief that if something is wrong with the animal, we give it a pill, and that means that it will then fix the animal and it will become healthy. In the case of diarrhea, most of the time, this pill will be metronidazole, for example, which is a drug that basically wipes out the microbiome and has other side effects, including vomiting and diarrhea. And it's just a pill that's been handed out like TikTok. We need to kind of move away from that. But unfortunately, and as much as I love it that many people are shifting to a more natural approach to healing, the pill for every ill approach has now become a supplement or a herb for every ill. And this is the same faulty thinking and faulty logic that keeps our pets from truly healing. So I call this holistic medicine, because this type of reasoning has bled into holistic medicine. For example, if you have a dog with diarrhea, what's your first thought, aside from metronidazole? Is it, what probiotic can I give my pet? Or what yeast protocol should I use? Unfortunately, after many months of trying, the animal is still not feeling better, because this faulty logic is not really giving you the results, and it's not really looking at the underlying cause. This underlying cause has never been explored. So we need a whole new way of looking at the body and healing if we want to have success. And that goes for the gut and any other health issue, really. So this kind of logic that I just mentioned and talked about is a bit like putting a piece of duct tape on the car engine light when it comes on. I mean, that would be utter stupidity, and who would do something like that? Because if we did, then we would end up stranded on the side of the road in no time. But that's what we do in medicine. We cover up the symptoms that tell us something is wrong, instead of trying to figure out what it is that is causing the symptom. So we need to bring that logic and common sense back into medicine, because otherwise we'll just end up with a supplement graveyard. Who here has one of those and has spent a fortune only to find themselves nowhere closer to the goal than when they started? You know, raise your hand. I'm pretty sure there are quite a few. I mean, I have one of those as well. Because, you know, we try things, but anyways, there's definitely ways to limit that from happening. So we need to do a little bit of brain unclogging today. So that's what we'll do. So who here is ready for that? Raise your hand. Great. Thank you. I'm really happy to hear that you're ready, because you'll learn a lot. So I always start out with asking this: are you happy with the results that you're currently getting from your animal's health care? And feel free to write your answer in the chat box if you want. When I ask this question, many people will obviously answer no, because for obvious reasons, they don't usually come to me unless their animals are already healthy, although I kind of appreciate that more, because I much prefer helping people to keep their animals healthy and help prevent disease than the other way around. So today we're going to talk about how we can do things differently, because we need to do things differently if we want to be able to get different results. Yeah, so lots of no's. You're not happy with the results. Yeah. Sadly, today, most pet parents really go from vet to vet with no lasting improvement of their animal's health, because they're really only given Band-Aids or metronidazole, you know, rather than uncovering the root cause. So it leaves them wasting precious time and money while their pets continue to suffer. And then in desperation, they often resort to becoming their own pet's vet, because they're not getting the help that they need. And they have to try to put the pieces together through online research. The empowered pet parent, on the other hand, has discovered the root cause of disease and has also learned what is needed to restore and maintain health. They have become proactive in their pet's care and have gained a deeper understanding of how the body works. They use a proven method, and their pets experience a happier and healthier life. So which scenario do you prefer, and where are you? And no judgment here, because, you know, it's important that we assess the situation and see where we are. Yeah, you tried everything and you feel hopeless. Michelle, you're becoming empowered. That's great. I'm happy about that. Always looking for good information to improve. Awesome. Very good. Yeah, it's really sad. It kind of breaks my heart. And this is why I do what I do is, and why I like to educate people, because there's so much pain that can be avoided. Because if we know things and if we can be empowered, then everything can be a lot better. So this webinar here is obviously for you if you were ready for a change, if you've tried everything and your pet is still not feeling well. You feel overwhelmed by all the information available and don't know where to start. You want to find the root cause and maximize your pet's health. You want the guidance of a truly holistic vet and be part of a loving, supportive community. You want to become a troublemaker and help heal the broken healthcare system, because the more you know, the more you can pass on that information. And I just lovingly call you guys my troublemakers. And if you want to be proactive and an educated client who also can support your vet, because the more you know, the better you can support your vet and in what they do, and the easier it becomes for them. And if you're a pet professional and you would like to support your clients and customers better, then this is for you as well. And then if you're ready to take action, obviously. Because as Einstein says, if we repeat the same thing over and over again and expect the same result, that's the definition of insanity. So we need to take action in a different way and not repeating what we've done. So taking action is very important. I know some people may not be all that inclined to taking a holistic path, because it's not an easy path. Results are not instantaneous. So if you have diarrhea today and you're going on a holistic path, most likely tomorrow they're still going to have a little bit of diarrhea. So it's not going to heal overnight. So it's totally okay if that's not for you. I certainly don't want to waste your precious time. So you can certainly leave them that masterclass if you're just looking for a quick fix and a natural band-aid, or if you're not interested in finding the root cause and explore new ideas and change, or if you think that you already know everything about holistic pet medicine, which I'm learning every day. I'm learning something new every day, and I've been in the holistic field for quite some time. So we all have room for more learning, but not everybody is into that. I understand. And also, if you only want to gather information and you don't take action, because without taking action, nothing changes. And then also, if you get upset if I give you 45 minutes to 60 minutes of strategies that has helped hundreds of animals, and then you complain when I make you an offer for an exclusive opportunity to work with me, because I will be inviting you to apply for my holistic pet health and longevity program at the end of this class. So just be aware of that, because I'm super excited to welcome you into the program if you feel that it's a good fit. My mission on this planet is really to empower you and give you the knowledge and support so that you can create the healthiest and longest life possible for your fur families. So be ready for that. Okay, so please, either way, I hope that you stay until the end, because I know you'll learn something new. And after I give you my strategy and tools to help your pets, I will open up the floor to questions for extra guidance at the end of this webinar. So who's ready to dive in? Give me a thumbs up or raise your hand. Yay, looks like a lot of people are ready. Awesome, very good. So before I dive into the tactics, I want to give you just a little bit of history on what qualifies me to deliver this life-changing information to you guys. Not all, I mean, some of you obviously know me already, but not all of you know me. So I want to share a little bit of information about me. So I've been a holistic vet for about 27 years, but I was already kind of primed and ready to go the natural way because of my parents. We had our own veggie garden, and my mom would make some nasty tasting herbal concoction when I was sick. And so I learned early on, and I also learned to honor and care for all living beings, including our planet Earth. And even before I went to vet school, I already supported the animals in my care through unconventional ways. And I was never really satisfied with the status quo, and always asked questions that then made my teachers really nervous, especially in vet school. As you can imagine, the professors didn't really appreciate my questions so much, so they would kind of try to ignore me and run away. It was really hilarious. But thankfully, I met many people on the way who kept bursting my little bubble with new thought-provoking and life-altering information. So I was really lucky to have a lot of people on my side, kind of pushing me along. But unfortunately, being off to a good start didn't really result in good health for me. I had a lot of stressors, including my mom's passing, the intensity of vet school, and then the challenges to step into the world as a veterinarian. They all took their toll. So I became quite sick with chronic fatigue syndrome, and my couch, unfortunately, became my best friend. And for many years, I had zero energy and felt like I was dying. And during that time, obviously, I had time to devour a ton of information, and I also tried so many different healing modalities in an attempt to really recover from my disease. As you can imagine, I left no stone unturned, and with each stone, I learned a tremendous amount. But what really pulled me through this difficult time was my strong belief that if my body breaks, I should be able to fix it. I had so many mentors along the way. They taught me to be open, courageous, brave, and they also taught me that healing comes from leaping into the unknown. And I know that a lot of you are kind of in that box where you don't really see out. And I want to help to kind of break that box open so that you can see beyond what you know and can see some more solutions. So anyways, as a Taurus, I was always called very stubborn. I call it persistent. So in any case, I was really 100% committed to curing my body. And I did. I recovered from chronic fatigue syndrome, but my healing journey didn't really end there. Several years later, I was knocked over by a pony and ended up with a protruding disc into in my neck area, and that sent radiating pain down my arms that was really excruciating. As a result, I had to take some painkillers because it was, as I said, excruciating. I could barely move. There was so much pain. And unfortunately, I then ended up with an autoimmune disease from these pharmaceutical drugs. So they triggered an autoimmune disease. And, if I'm honest, I really needed to experience this excruciating physical pain that it brought because I was so closed off to conventional medicine and in desperate need of integrating both of these worlds for my patient's sake. Thankfully, by that time, I had discovered that it takes a system and a methodical approach to restore function and heal. And so it only took me 2 years to fully recover and be in better health than, I was before. And that was like 7 or so years ago. So today it would have gone even faster, but I really needed to kind of experience that autoimmune condition and that pain so that I could become a better veterinarian and a better teacher, basically. And I've been the biggest fan of poop for 8 years after meeting Dr. Margot Roman. I'll tell you a funny story later. And the miracles that I witnessed with this simple treatment really sold me on poop. And as I mentioned, because I run around wearing a poop hat, especially when I do fecal transplants, I think that's the secret ingredient, that we need to make this work. That's how, anyways, I got the name, the Dr. Poop Lady. So I can relate to you and your animals because I too suffered from 2 debilitating diseases that most people never recover from. I was told, yeah, you can't cure that. And I said, yeah, well, we'll see about that. So I do see a lot of animals with chronic conditions that really considerably impact not only their lives, but also that of their caregivers. And because of my own journey and what it put me through, I was really forced to question, examine, and learn, change, and grow. I mean, I was really put through the paces there. But my body taught me and continues to teach me more than vet school ever could and made me the veterinarian that I'm today. And I'm sure you guys can relate to that as well. Your own body teaching you and your animal's body teaching you and bringing you here to learn more. So I can relate. And what I really discovered was that it takes all of the pieces of the puzzle to really create a whole. So I'll talk to you more about that because that's really important. That's one of the bigger mistakes I made, was to just piecemeal things, do a little bit of this and then hope it would clear up, and then do a little something else and hope that would help. And it's not until I put all the pieces together at once that I really started to regain my health. So this is why I'm so excited about sharing this approach to healing the gut with you, because it really truly changed my life and helped hundreds of my patients go from poor quality of life to enjoying vibrant health. And this is one of them, Luna. She had suffered from chronic diarrhea, and her person was so happy that it resolved pretty quickly. I mean, it wasn't super complicated. I think we just did a fecal transplant. I can't even remember. But it wasn't very difficult. She recovered really quickly. And he said that Dr. Suter has been unbelievable with my dog in the past couple of months and has been able to restore her health. I highly recommend Dr. Suter to anyone who loves their animals. And then another one here who had some fly snapping seizures, and I saw that somebody mentioned seizures. So Jill says, prior to meeting Dr. Suter, we were living in fear of our dog's illnesses, back and forth to specialist vets with more and more medication. After only 3 months of working with Dr. Suter, our dogs have remarkable health improvements. Specifically, our dog, the one that had the fly snapping seizures, our dog really rarely wagged his tail and was very anxious. He's now a happy, healthy, calm boy, clear eyes, wonderful demeanor, and constantly wagging his tail. We cannot thank Dr. Suter enough. So with the proper approach, everybody can get to a place where they see improvements in their animals. Of course, it depends on where they are in their ability to heal and how much they can improve. There's no guarantees that an animal will be completely healed, but there can always be a lot of improvements when we apply this system. And what I've seen with that is lots of miracles. And another one here, this is Galen. He had diarrhea since he was a puppy and was vomiting and nothing helped. Today, Galen's bowels are perfect. His appetite, energy, and mood are great. He's Mr. Mellow, and when he springs into action, it's beautiful and impressive. With my expressions of deepest gratitude for saving my precious boy from a short life of misery. And I like that, what she said, you know, the saving her boy from a short life of misery, because when the gut is unhealthy, that's basically what ends up happening. It becomes a life of misery. So if we can reverse gut disease and help the entire body to heal, then the animal does not have to feel miserable all the time. So are you ready to learn how to do the same for your pets? Raise your hand if you are. By having this gut healing strategy at your fingertips, your pets can achieve optimal health. So imagine where your furry friend and you could be in just 1 year, because I don't want you to spend a decade trying to fix your animal's health. You know, I don't want you to waste precious time and money. Plus, truth be told, your animals don't really have a decade because they don't live that long. So I want you to dare to dream and imagine what your animal's life could be like. You know, feel free to write it down so that you can remember it and kind of keep that goal in mind. So imagine your dog being really happy, your cat being super happy, you know, running outside with your kids with a big smile on their faces. How would you feel if your pets lived their healthiest life possible? Feel free to share it in the chat as well so that other people can see it if you feel like it, because I just want you to feel like there's a community and that you're not alone in this. So let's dive in. This process is what I go through when I work with the animals. So when they come to see me, my first question is obviously, what is going on? I want to get the whole picture. I want to get the history of the animals so I can help figure out what the next steps can be. So part of that initial discovery is also running the right tests. Then my next question becomes why? You know, why did the body break? What causes it to malfunction and become sick? And only then am I ready to come up with a treatment plan. You know, how do we fix the problem? So this is kind of what we need to work on, because I hope you can appreciate that we are trained to go from a very incomplete what. Basically, you know, your dog has diarrhea. Okay, let's give it some metronidazole or give it a probiotic. And we don't really, you know, play enough detective to figure out what's going on, because the whole body is affected. We need to really have a good idea of what's going on so that we can understand what we need to do and then how we can fix it. Understanding the what also requires that we understand the gut in its healthy state, because otherwise we don't really know what it should look like. It would be like trying to recreate a painting without ever having seen it. That's quite impossible. So we really need to have some good foundation for that. The goal of the next few slides is really to share a bit of awe that I feel when I think about the gastrointestinal tract. In my opinion, the gastrointestinal tract is a superhero because it takes relatively big chunks of food and breaks it down into the tiniest particles that can then be absorbed into the body to build this amazing complex system. In the process, it's also capable of distinguishing good from useless and eliminates indigestible foods and toxins. Furthermore, it also creates a barrier to the outside, and it houses the microbiome. So quite the superhero. And just to remind you, in case you forgot some anatomy here, the mouth would be up here. We have the esophagus that's connecting the mouth to the stomach, and then food goes from the stomach in the small intestine, several loops right here, and then from there it goes into the large intestine and out the rear. And I want to point out one area right here because it will help you understand why pancreatitis and liver issues are often connected to small intestinal bacterial overgrowth in this area. So we have the pancreas right here, and we have the liver and gallbladder. And the bile duct and the pancreatic duct, they join into the small intestine in the same place, basically. So anytime we have a microbial imbalance or inflammation here, that inflammation or microbial imbalance can affect the pancreas and the liver. So just a brief aside there. And this is the intestinal wall. We have a tube, that's a small intestinal tube, and when we cut it open, we can see that there are a lot of folds right here. And then if we take just a little bit of one of these folds and enlarge it further, we see that there are even more folds. And we can also see that these folds are lined with just one layer of cells. And these folds also have blood vessels and lymph vessels that reach into them so that nutrients can then be transported to other parts of the body. And when we take one of these little cells and enlarge it even further, then we can see these little finger-like structures that are on top of the cells. And these are called the microvilli brush border. So that's just to show you how incredibly complex this gastrointestinal tract really is. And if we were to stretch it out, then it would be about the size of 2 tennis courts, I believe, in humans. Obviously, if you have a Chihuahua, it's going to be less than a Great Dane, but you get the gist. It's a huge surface area that serves to absorb nutrients. And as I mentioned earlier, the small intestinal mucosa can really completely renew itself in just 4 to 6 days in humans and every 2 to 3 days in rodents. And I didn't find any numbers for dogs and cats, but I would assume it's kind of in the same neighborhood. So quite amazing, that system. What does the intestinal tract also do? It provides internal protection. I want to talk about that just a little bit because a lot of people get really worried as soon as the animal has a little bit of diarrhea. Because one way for the body to get rid of something that's not supposed to be there is to increase peristalsis, and that then can cause diarrhea. So things are moving through more quickly. And that peristalsis can also be increased the other way around, and then we end up with vomiting. So it's not always a bad thing. Obviously, if it goes on for too long, that's a problem, but just a little bit of diarrhea or vomiting one time, that can be very cleansing. Enzymes also help with protection. Low stomach acid will kill microbes and not allow them to go through. And then we also have, obviously, the rinsing effect of digestive juices. So again, back to diarrhea. With these digestive juices, we end up with getting rid of the pollution, basically. So dilution is the solution to pollution. So just stopping diarrhea anytime it comes up. Again, I'm not talking about chronic diarrhea that's going on forever. I'm talking about more of the diarrhea that, they might get if they eat something that they shouldn't have, for example. So allow the body to get rid of it. And then we also have mucus that protects the gut and gut-specific immune system. And of course, the intestinal flora, the microbiome. So this here is an image of the loop, again, enlarged. And you can see the intestinal lumen right here where the food and the microbes would be. And then we have the folds here again. And then right here, these little nodules here are all lymphoid tissue. This is the tissue that basically communicates with the microbes and keeps the body as healthy as possible. It's a very complex how this immune mechanism works, but it's everywhere. And you can see these nodules are very close together, and they're basically lining the intestinal tube, the entirety of it. And that's why about 70 to 85% of the immune system is in the gut, because we have so many of these little nodules right here. And then we obviously also have the microbiome, and that's where even more awe-inspiring happens for me when I talk about when I learn more about the microbiome. And the microbiome is basically made of about 100 trillion microbes, and that can be bacteria, viruses, fungi, parasites, protozoa, etc. So it's basically a community of microbes that it lives in and around us. And there's a lot of these microbes. Most of these microbes are really in the gut, but we also have a biome on the skin, the ears, the eyes, the nose, the mouth, etc. So it's basically everywhere. And they outnumber our cells by a factor of 10, and genetically they outnumber the body by a factor of 150. So you can imagine that's amazing. And because of that, they basically code for 90% of all metabolic processes in the body. So they're incredibly important for the metabolism of the body. Researchers so far have found more than 10,000 different species of microbes. And they also found that about 200,000 microbes are present per immune cell. So these microbes are really the first line of defense. And what do? We try to kill them, right? With sanitizers and, disinfectants, etc. But, based on these numbers here, who is running the show, right? I mean, we have to ask that question, and we need to make friends with them. But unfortunately, today, we have a bit of a lack of diversity happening. There's been a decrease in diversity of microbes by about 50%. So kind of like the extinction of certain birds and other animals, this is also happening with the microbiome. So we need to change a little something, and we need to view things a little bit differently. And this slide here certainly helps with that as well. Because when we look at it from a genetic perspective, the fruit fly has about 13,000 genes, and the flea has 30,000 genes. And I don't know if anyone wants to venture a guess of how many genes we have. Well, you'd be surprised, but we have, dogs, cats, and us humans, we have somewhere around 19,000 genes. So we're somewhere between a fruit fly and a flea. So how is it possible that we can be so much more complex than a flea and a fruit fly if we don't have a whole lot more genes than what we have? Well, it's because of the microbiome that we can have this sort of complexity. And even in the brain, researchers have found in one study that there are 173 different species of microbes in the brain. So these microbes are really basically running the show. They're kind of the cruise director. So without these microbes, we can't really do much of anything. We would pretty much be dead very quickly. So who is just as much in awe as I am just from hearing that? Awesome. Yeah. Good. I'm glad. My job is done. Anyway, so these microbes, they're really a huge chemical factory, and they help with intestinal maturation. So it's imperative for puppies to have a good microbiome so that their digestive tract can really develop properly. But, what do we do when they're puppies or kittens and they have Giardia or something else? We deworm them and we give them anti-parasitic drugs, and then if they happen to have the sniffles, we give them some antibiotics on top of that. And so we basically destroy their microbiome from when they're very young. And often animals will not recover from that if they don't get any, specific attention or support, just like with Galen, the white dog that I showed you earlier. He had diarrhea and vomiting since he was a puppy. But these microbes, they're also good at inhibiting the pathogen growth in the intestines. They help to digest and break down food. They also help to regulate hormones and excrete toxins. And they produce vitamins and other healing compounds that are necessary for the body. So, for example, if you have a dog or cat who's deficient in B vitamins, B12, for example, that is a sign that there is an imbalance in the microbiome because the microbes in the gut are making B12. So if there's a deficiency, then we need to look there. And it also makes a lot of neurotransmitters that then regulate mood and behavior. So anytime we have behavior issues, we also want to look to the gut. And Dr. Roman actually told me the story of I think he was a Jack Russell type of dog who was always quite aggressive towards his sister. And then he got a fecal transplant, and the next day he was licking his sister and, being all lovey-dovey with her. And that was quite incredible. And then when he received I think it was a preventative treatment, heartworm or something like that, he reverted back to being aggressive towards her until they repeated the fecal transplant with the same result. So a lot of these things affect the microbiome and the gut, and that's what this next slide is about. What hurts the gut, what causes problems to the gut. Oh, he was on Interceptor. Okay, thank you, Dr. Roman. You probably tell the story better than I do, but yeah, it kind of stuck in my brain anyway. So poor diet, high carbs, processed foods obviously hurt the gastrointestinal tract, and there have been studies that have shown that diet composition will modify fecal microbial composition and the end product of fermentation, so basically what they make. And they found that the administration of raw-based diets promoted a more balanced growth of bacterial communities and a positive change in the readouts of healthy gut function in comparison to a commercial extruded diet. So there's a lot going on with diet because these microbes, they depend on diet. And they're also the ones that tell us, what we should eat, depending on what's more predominant. Food sensitivities can also hurt the gut because they keep the inflammation going. And then chronic low-grade infections such as dysbiosis, so an imbalance of the microbiome, yeast, parasites, lack of enzymes, because then food is not broken down properly and just ferments in there and causes havoc that way. Hormone imbalances can be an issue. And then toxins, mercury, mold, agricultural chemicals, etc., can also damage the gut. And then vaccines, because a study done at Purdue University found that all vaccinated dogs had autoantibodies to their proteins or to some of the proteins. So that may also be affecting the gut as a result, because the gut is also made out of protein in part. And then we also have drugs such as non-steroidal anti-inflammatories, steroids, obviously antibiotics, chemo drugs, radiation, preventatives. All of these things also affect the microbiome. So when we give drugs, we always have to take that into consideration. And then any animal that's overweight and has excess fat, that fat turns into a chemical factory. Basically, it makes inflammatory chemicals that then also affect gut health. Lack of exercise is also a problem because that also kind of keeps them maybe feeling not as happy and can lead to stress, because stress definitely affects the microbiome as well. The way it does that is an increase in cortisol will then be sensed by the microbes in the gut. And as a result, they will turn on virulence genes that then cause more dysbiosis. So they will react or respond to that excess cortisol. And then probiotics and prebiotics can be an issue as well. And I will talk to you a little bit more about those in a little bit. And then not to forget, electromagnetic radiation also is an issue, because what that does is it disrupts the communication in the entire body and also between the microbes, because a lot of the communication in the body works through electricity, and that's how we can measure EKG. And so when we add electromagnetic frequencies that are foreign to the body and are disrupting that communication, then these microbes within that communication will not be able to communicate with each other, because microbes that live in the community, they engage in something called quorum sensing, where they basically talk to each other. So for example, if there was a load of salmonella entering the gut, the resident biome would then start to produce compounds to prevent salmonella from causing issues. So when we disrupt all of that communication, that can then become a problem. And today we are living in a very toxic environment. Since World War II, 1.5 million new chemicals have come on the market. And most of them are carcinogenic and have never been really tested for safety. 80,000 of these chemicals also interfere with hormones. They're xenoestrogens. And you can see here on this graph, it shows that in the 1940s, we had less than 1 million kilograms of synthetic organic chemicals that were used. By 2008-ish or so, we were at 200 plus billion. I mean, imagine that. So we went from less than a million to 200 plus billion. That's incredible, and that's very difficult for the body to handle. And aside from the liver, obviously, being very taxed by that, the microbiome and the gut are very taxed by that too, and in particular through glyphosate. And I want to spend just a few minutes on the most damaging toxin, which is glyphosate, which is the active ingredient of Roundup. I mean, there are more toxic chemicals that can cause a lot more damage, like arsenic, but glyphosate is very toxic because it's everywhere in the environment. It's used as a weed killer and also has antibacterial properties. It is used on wheat and other crops as a desiccant, which means they basically spray it at the end of the growing season just to get them to ripen faster. So when you're buying wheat and some other crops that they spray, like oats and legumes and such, then you're basically getting quite the load of glyphosate. But today, we have about 85% of all air samples and rain samples that contain this chemical, and 70% of American household drinking waters also have this water-soluble glyphosate in them. And if we were to stop use of glyphosate, it would stay in the environment about 50 to 60 years still, which is a lot better than some of the other chemicals that take a lot more time to degrade. But in any case, it would be good if we could stop, because glyphosate significantly disrupts the microbiome, again, because it's an antibiotic. But it also destroys these little villi, these little finger-like structures that I showed you earlier. And in humans, they have found that it upregulates gliadin receptors in the GI tract, which then increases gluten sensitivity. And that makes sense because we see so many gluten-free things now, because a lot of people have become a lot more sensitive to gluten because of glyphosate. Glyphosate also opens up the gut barrier, so it creates leaky gut. So it basically breaks the connections between the cells of that gut lining open. And it does the same in the brain as well. It opens up the blood-brain barrier, and it also has similar action in the kidneys. That's why we see more kidney disease as well. And in the presence of glyphosate, heavy metals become 1,000 times more toxic. So glyphosate is definitely not a good thing to have in the environment. And we need to do everything we can to reduce the amount of glyphosate that we ingest. And one way of doing that is by looking at diet. This one study, looked at different diets, and what they found was that there was glyphosate in every product. They related the glyphosate more to crude fiber content, so more likely they thought that it was originating from plants, which makes sense because it's the plants that are being sprayed with it. And they found that commercial pet foods result in 4 to 12 times higher exposure than in humans. So eating a commercial dry pet food really raises that glyphosate level. And the way we can check glyphosate levels in an animal is through urine, because glyphosate gets excreted in urine. And what they found was, again, that dogs and cats have much higher levels of glyphosate in the urine than humans. With food, thankfully, we have a choice of decreasing glyphosate intake or exposure, and especially if we feed a raw food that has virtually no detectable glyphosate, they found. They found a little bit more glyphosate in canned food, and then also more in dry kibble. And the highest level of glyphosate was actually in the grain-free kibble, which is mostly composed of oats, pea protein, chickpeas, lentils, etc. So grain-free kibble was highest in glyphosate. And that makes sense because oats and legumes are sprayed heavily with glyphosate. So one way of limiting that is to feed a diet that just already is lower in glyphosate. And that's just to kind of show you the increase of glyphosate. So there was not a whole lot of use of glyphosate in the 1990s, and then it increased with the different crops. But anyways, what I wanted to show you here is there's an increase in glyphosate, and at the same time, we have an increase in superweeds thyroid cancer, diabetes, Alzheimer's, kidney disease, obesity, cholesterol, liver cancer, Parkinson's, stroke, celiac disease, IBD, Crohn's disease, and autism. So you can see that there's a parallel. Now, obviously, just because there's glyphosate there doesn't mean that it's causing that, but it's very suspicious, I would say. And what happens is it creates a lot of inflammation. And that same thing we can also see in the cancer incidence of dogs. So we have a 2.3-fold increase in just 17 years from 1989 to 2002. And I want to point out that they stopped the study here, so we don't really know what happened in the last 20 years. My thought is that it probably is even steeper and increased even more. But what's curious is that we see a kink here and a steeper increase after GMOs hit the store in 1994. And with GMOs, there was a lot more glyphosate that was sprayed. So one has to wonder, obviously. What do all of these things do? How does glyphosate, antibiotics, etc., affect the gut? Because I want to show you how it does that, and then also why it has such far-reaching effects that it will really make sense. So here on the left side, you can see there are 3 cells that are really close together, and that's what it normally should be like. Okay, these cells are supposed to be really close together. But when we have some of these offending things, it will affect how closely these connected cells are staying together. So these little tight junctions that are between the cells are loosening up and creating some space, and some of them even completely letting go so that there is actually a space between the cells. So as a result, particles, food particles that are supposed to be digested and go through the cell to the other side, they are actually going through undigested or poorly digested and go directly into the bloodstream on the other side. And you can see that there are also little microbes that cross over, and then some toxins that cross through that would normally not go through because these tight junctions would be really tight. Nothing could pass between the cells. So what happens when we have these foreign bodies that are on the other side? Because these are really foreign bodies. It's kind of like having a thorn in your finger, right? And it's not coming out, and then it gets all red and inflamed and such. So why does it get all red and inflamed? Well, it's because the immune system comes running anytime there is something embedded or going through that isn't supposed to be there. So the immune system will go and clean this up and cause systemic inflammation as a result, because these particles are taken up into the bloodstream and then they go all over the body. So we end up with inflammation all over the body. And obviously, because these particles are not completely digested, they're also not useful on the other side, because the body doesn't know what to do with it. So as a result, the animal ends up with a nutrient malabsorption and becomes deficient. It can also cause autoimmunity because some of these particles look very similar to the organs or the particles that the organs are made of. For example, gluten looks very similar to the thyroid gland. So if somebody has gluten sensitivity, which, we all really do have that, but in some people that will then trigger Hashimoto's, which is autoimmune thyroiditis. That's how some of these autoimmune diseases are created. Then we can also end up with food intolerance, because if the immune system is on the lookout for chicken because it doesn't like the chicken, because the chicken was in the wrong place, then it will already start to create inflammation here and already be on the lookout when chicken comes along. So every time your dog eats chicken or your cat eats chicken, then some more inflammation will occur. And then, as I mentioned earlier, anytime we have a breach in this gut barrier, we also have a breach of the blood-brain barrier. So in the end, what happens is we have a lot of fire going on in the system, a lot of inflammation. And that's obviously not a good thing. And it also affects the liver, for example, because if there's inflammation everywhere, the liver becomes inflamed as well. And if we don't have enough nutrients like B vitamins and other nutrients that are being absorbed, then the toxin processing in the liver is going to be inhibited. And if we have leaky gut, then some of these toxins that are secreted through the liver and supposed to go out through the bowels are being reabsorbed because of that leakage. So it's basically a recycling of toxic substances. So because we have so many toxic chemicals in the environment, we also need to support the detox pathways of the body. And these toxins, if they're not eliminated, they will also affect the gut. So the gut affects the liver, and then the liver is not able to process them. So anyways, it's like one big mess, right? You can see it's really connected. You cannot separate things from each other. And so it's really important that we support the detoxification. But one of the mistakes that I see is that people start out with detoxification before the gut is somewhat healthy and before there are enough nutrients going into the system. Because let's just say we're missing a lot of the amino acids and sulfur containing foods that are supporting phase 2 of detoxification. Well, that's a problem, because in phase 1 of detoxification, these toxins that are fat soluble are actually turned into much more toxic compounds. So after phase 1, they're like super toxic. And phase 2 then neutralizes them some so that they can then be removed. But if we don't have phase 2 happening properly, then we have even more toxic chemicals. So we want to make sure that all of these nutrients are getting into the system. And one way of doing that is to heal the gut and provide them with a good diet. I had listened to a podcast by a psychiatrist who was mostly working with autistic children. And what she found is that just fixing the gut was significantly decreasing the level of heavy metals that they had in their system. So she would do a hair mineral analysis to see what heavy metals were present. And then she was treating their gut for a year, and then she was retesting a year later, and these kids had much less chemicals in there. So just fixing the gut already helps a lot with detoxification. All right, and then other systems that are also affected by the gut are the hormone metabolism. I'm just taking the thyroid metabolism here as an example, but it goes for other hormones as well. So we have the thyroid, that's right next to the throat here, that makes T4. T4 is the inactive form of the thyroid hormone and gets converted in the liver to T3, which is the active form. So T4 is like crude oil and T3 is like gasoline. Okay, so the body really needs the gasoline in order to work, because if you were to put crude oil into your gas tank, I don't think your car would be very happy about that. So anyways, the body needs T3. And there's also some conversion in other tissues, but also the gut converts 20%. You can see it's related again, and everything is related. So the gut is related to the liver is related to the thyroid gland. So it helps with detoxification so that the thyroid gland doesn't become toxic, but the thyroid gland also provides T3 to the liver so that the liver can then function, because T3 tells the cells how fast to work. And if there's not enough thyroid hormone, then everything becomes really sluggish, and then toxins kind of stay stuck there, and the gastrointestinal tract doesn't renew itself as quickly, etc. So it's really all connected, and that's really the point that I'm making here. I'm not trying to overwhelm you with a lot of information. It's just more to point out that everything is connected, and we kind of tend to forget about that. And then, of course, why do dogs eat poop? That's always the question. And usually the question is actually, what can I do to stop my dog from eating poop? And my counter question always is, well, should you stop your dog from eating poop? Obviously, if you know that a dog just had dewormers and antibiotics, you want to keep your own dog away from that dog's poop for sure. But I also have seen dogs that are having some gut issues and some other issues be very specific about which poop they want to eat. And I have one client, he's a Jack Russell. He has a corn sensitivity, and unfortunately the owner has not been able to fully eliminate corn from the household. And so once in a while he gets into a few crumbs of corn and ends up with more skin issues again. And so we do a fecal transplant on him on a somewhat regular basis. And in any case, they added 2 other dogs to the household, and these 2 dogs will only eat his poop. So they will only eat Bubba's poop. They will not eat each other's. They are not eating their own poop. They only eat Bubba's poop because it's especially good. One of the people in my program has 14 dogs, and she noted that her dog, who has more of the GI issues, that he only goes for poop of those dogs that are really happy. So he's also quite specific as far as what kind of poop he wants to eat. So should we stop it? Of course, we have to pay attention to what they're eating, and especially if it's horse poop, if they were just dewormed, that could be a whooping dose of ivermectin, which could basically kill them. So you still want to be careful. So anytime your animal is doing something like that, you can always ask them, how do you plead? And then they can say, not guilty. My bacteria made me do it. If you're chopping somebody else's head off because you're in a bad mood or something, you can just say, well, it's my microbes. I have nothing to do with it. They are outnumbering me anyway, so they're at fault. So anyways, when we talk about the microbiome, there are many different ways that we can replenish. And for us humans, letting our dogs lick our faces, that can be a way that we can get more, allowing them to kind of self-select a little bit what they need and what works for them. And then for us humans, it's a little bit more difficult because fecal transplants are only allowed for people who have a C. diff infection here in the United States. So what I usually do, on a semi-regular basis, I go into public bathrooms because, they flush and then bacteria float all around. So that's how I get my diversity. So in any case, we really need to embrace these microbes and let them help us, because if we want to keep this sort of environment and still have this sort of nature available, then we need to embrace things. If we want to keep it, we really need to stop the war on everything, and we need to reconnect and embrace nature with all of its living beings, and that includes ticks and mosquitoes, because they too have a function on this planet. So all living beings and plants and bugs, etc., have a purpose. Parasites, for example, they're capable of accumulating toxins and protect the host as a result from all of these toxins. So they can basically pull toxins out of circulation. Yeast as well is capable of bioaccumulation of heavy metals. So if you see that your dog or cat has a yeast infection, or you think that's what it is, then you want to look a little further. Is there some toxicity happening? Why is yeast even there, instead of just reaching for like a yeast protocol? So it's really important that we look at the bigger picture, and especially if we want to prevent the extinction of all of us, we really need to stop the war on everything and embrace things instead of killing everything, because it's only going to kill all of us. And we see it happening. I mean, there are more and more diseases these days. So we really need to reconnect with nature and make friends with all the organisms if we want to turn things around and survive, because we're not alone here. It's not just about humans, it's about the entire planet. So now that we know a little bit more about the gut, we need to look at how we can reverse the damage. So what are the next steps? We want to start with some testing. We don't want to just guess. And that helps us to determine the underlying cause. So for example, if there is a microbiome imbalance, it's good to know that, right? And then we want to focus on the cause and not just the symptoms, and correct the dysfunction and not just alter it with drugs and cover it up. And we want to address the whole body with a systematic approach. And in order to do that, it's really helpful if we have a mentor. Because what I see in my practice is that most failure is due to not having a system. And that's also what kept me sick for so long, was to not have a system. And once I had a system, I was able to recover much more quickly. And for example, now for my last indulgence in gluten in Europe, I recovered pretty quickly because I knew how to fix things. So I'm already probably 90% better. So it doesn't have to take forever. Obviously, sometimes if the damage has been going on for a long time, it can take longer, but it doesn't have to. Those are some of the tests that I run. I always start out with a CBC chemistry panel just to get a bit of an overview of what's going on. I check for fecal parasites because I want to know if there are parasites there. If there are parasites, I would want to treat for parasites first to eliminate those, and only then do the microbiome test, because the antiparasitic drugs or herbs that I might use can affect the microbiome composition. So I wouldn't want to do that before I check for parasites. So animal biome has a good test for microbiome. And then I also like to run food sensitivity testing, because if there's a food that keeps fueling the inflammation, then no matter what I'm going to do, it's not really going to work, because it's like trying to extinguish a fire while you're still pouring oil on it. So I want to know what food sensitivities an animal might have. I will also do some hormone testing, because I have found that a lot of animals have a deficiency in cortisol. So they're kind of moving a little bit towards Addison's, and replenishing the hormones can go a long way with chronic vomiting and diarrhea. We can obviously also do fecal cultures and other types of tests. We can do elimination diets, which in conventional medicine considered to be the gold standard, but that takes way too long and it's not very accurate anyway. And then, of course, we can also do ultrasound, biopsy, endoscopy, and those types of more invasive diagnostic workups. But generally, I already find problems in that neighborhood. And so I start working on that. And very rarely do I have to send an animal to have an ultrasound or biopsy done. That would be more if I suspect that there might be some intestinal lymphoma or something like that. But generally, I find that the issues are already kind of coming to light with these tests. And then we're diving into the long-awaited gut healing, right? So with the healing strategies, I use a 4R program, which comes from the Functional Medicine Institute, which is a human institute for functional medicine where they train doctors in functional medicine. And basically the first R is to remove the bad. So getting rid of things that negatively affect the gut. And that's removing inflammation and sensitivity-provoking foods, processed foods, etc. And then also treating for chronic infections, yeast and unhealthy bacteria and parasites. The second R, the goal for that one is to replace the good. So we want to add back the essential ingredients for proper digestion and elimination. And that can be soothing herbs if there's a lot of inflammation going on, enzymes, or hydrochloric acids, if they don't produce enough stomach acid, for example. So anything to really protect the lining from further damage and also to help with digestion. And obviously, we also want to provide a healthy diet. The third R stands for re-inoculation, which has the goal of restoring the microbiome. And that can be done with fecal transplants and the aid of probiotics, prebiotics that all help to reintroduce proper flora into the intestines. And spending time in nature can be very important as well, because healthy soil contains a lot of microbes. So 1 gram of healthy soil may contain about 10 million microbes and about 2,000 to 5,000 species that directly communicate with the dog biome. So it's very important to spend some time in nature outside. And then we also want to provide nutrients to aid gut repair that help to repair the gut lining and regrow healthy cells and tight junctions. And that can be done with a variety of supplements, including L-glutamine, pantothenic acid, zinc, omega-3s, vitamin E, glycine, bone broth, colostrum, etc. So there are a lot of things that we can provide that help to nourish these cells so that they can recover. I do want to talk a little bit about probiotics, because probiotics is usually the thing that most people go for right away when there's a little bit of diarrhea or when they've had their animals on antibiotics. But unfortunately, that can be a bit of an issue. And this study here found that post-antibiotic gut mucosal microbiome reconstitution is impaired by probiotics and improved by fecal transplant. So what they found is that because the antibiotics were reducing the numbers of microbes in the gut, that these probiotic strains could then colonize and sort of take up space. And generally, probiotics are transient microbes. So they go in, they do their thing, and they leave. Whereas the microbiome of the gut, that's more of a resident microbiome. So what they found is that these probiotics were taking up space where there was more space after the antibiotic. And then as a result, the resident microbiome took much longer to recover from it. In contrast, doing a fecal transplant really helped significantly to accelerate that restoration of the microbiome in the gut. And when we look at probiotics versus fecal transplants a little bit closer, we can see that probiotics only contain about 1 to 10 species of microbes, whereas a microbiome transplant from a healthy donor dog has somewhere between 300 and 1,000 species of microbes. And microbes in the probiotics are often not the microbes that you would find in the normal gut flora, whereas obviously from a fecal transplant, those would be native to the gut flora. Probiotics also don't make any postbiotics, and postbiotics are all these chemicals that I mentioned earlier that the microbes produce. And we don't really know about efficacy. Do they help? Do they harm? Are they safe? I mean, for the most part, they are safe, but I do see animals that have reactions to probiotics where the microbiome gets more imbalanced. And if you look at the microbiome when it's imbalanced, if you're feeding the wrong side of the imbalance, then you can make it worse with a probiotic. And that can also be the case with fermented foods. So if your animal doesn't do well with fermented foods or probiotics, don't keep giving it for like months hoping that that will change. I would instead, go for a fecal transplant. I mean, that's usually my preference anyways. I don't really waste much time on probiotics. I think the last probiotics I sold was like 2 years ago or something. So fecal transplants are much more potent. They are pretty safe. And, if you don't have someone who can do it rectally, then you can also buy the fecal capsules from Animal Biome. They're pretty easy to give. They make them for cats and for dogs. All right, so I do want to share a little story here. This is Bear. He was my first fecal transplant patient. When I first met him, he had been diagnosed with IBD 2 to 3 years prior. So he had bloody diarrhea, vomiting, lack of appetite for quite some time. He had also gained some weight, had severe anxiety, a dry coat, itching, a little crust on his nose right at the large intestine end point. So the large intestine meridian ends right by the nose here, and he had a little crust there, which kind of makes sense, right? And then he would also have red ears at times. So when I met him, his treatment history had been eating Hill's prescription diet. He had gotten several rounds of metronidazole on Thailand for the C. diff infection, but the owners switched him to a raw food. About 5 months prior to meeting him, they restricted the types of foods he was getting because they had also checked him for food sensitivities. They were giving probiotics, enzymes, flax oil, and then some Chinese herbs for the gut and a little bit of milk thistle and slippery elm. So when I looked at him, he was still having varying fecal consistency. He was having a lot of anxiety and he was a little bit overweight and that crust on his nose. I can't remember if they did biopsies and all that, but in any case, he was diagnosed with IBD, had a C. diff infection, sensitive to most foods. And what I found, adding a little bit more testing, is that he was borderline hypothyroid. He had low cortisol levels and IgA. IgA is an immunoglobulin that is very dominant in the gastrointestinal tract. And when that's low, that can be a big issue. And it seems like some German Shepherds tend to have more of a tendency of low IgA. He had high estrogen levels that promote inflammation, but no parasites or Giardia were found. I didn't do any particular tests to find out about leaky gut, but it was pretty obvious to me that he would have leaky gut. And at the time, we didn't have microbiome testing. Animal Biome was not on the planet yet, so we didn't have that available. So what did we do? We kept going with a clean diet. Digestive support was continued as well. And then we did a fecal transplant, hormone support, a little bit of detox a little bit later on, and then also a little bit of chiropractic work to help his gastrointestinal tract. And this is his progress. So this was before he was getting the fecal transplant. And a few days later, we did a fecal transplant. And going back to Dr. Margot Roman, she had flown in from Boston to Chicago because she was attending a wedding. And so I asked her to bring me some poop so that I could do a fecal transplant on Bear. And she did. So I picked her up at the airport with her little bag of poop and drove up to Bear and did the fecal transplant. And this is what his poop looked like the day after. So it was pretty instantaneous. And according to the owner, he was a little bit more tired that day. But then the next day, he started to feel really good. She told me that Bear's poop was formed and all he wanted to do was play and his energy level was off the charts. So you can see that one pretty quickly, right? So that was Bear. That was my first fecal transplant patient, and that's him on the playground there having some fun. So gut healing doesn't really stop with the 4R program because it's influenced so much by other aspects, including the nervous system, hormones, exercise, and of course, emotional and mental health as well. So all of these need to be in place as well. So we want to make sure that we address detoxification once the gastrointestinal tract is a little bit better, healed a little bit better, and the nutrients are getting in. So we want to address that. We also want to address the nervous system because the gut is innervated by all sorts of nerves. And also the gut sends information back into the brain via that nervous system. So we want to make sure that we pay attention to that because sometimes things can just be due to a nervous system imbalance. And for example, this is Tiny. She's a Great Dane. Great name for her, Tiny, right? In any case, she's been a patient of mine for several years, but they had moved away a little further, so I hadn't seen her for a while. And when they came back, they mentioned that she was having a lot of discomfort in her GI. She would just sit on the couch and pant, and then she would burp, and then she would feel better. And so their conventional vet put her on some Gas-X, which didn't help. So what I did is I worked on her chiropractically, which, we did one session and she was marginally better. So I had her come back, and then I started to manipulate her whole abdominal area. And I felt that the area that was closest to the diaphragm was really rigid and kind of felt a bit like a rock. And she had a gastropexy as a puppy, which is basically where they tack the stomach to the wall so that it can't rotate, because these guys are a little bit more prone to that. So in any case, I moved things around and there was definitely a lot more motion happening. And so she went home, and 20 minutes later, I'm getting a text from the owner saying that she just threw up a pair of socks. So she has had these socks in her stomach for a number of weeks and were causing her some discomfort. So just because you see gut issues, you also want to think of other things that could potentially influence the gut. Galen, I mentioned him earlier. We did an ultrasound because he had an enlarged prostate. He's intact, so we just wanted to make sure it wasn't, pathologically enlarged. And in the process, the ultrasonographer found that the adrenal glands were a little small. So for him, we added a little bit of hormone support to help his digestive system, which made a big difference for him too. So you can see everything is connected, and just because there are GI issues, we can't forget about all of the other things, and especially emotional and mental health. Because what I find is that people who have animals that have recurring digestive issues, chronic things, oftentimes the people are very anxious themselves just because of that constant trauma, that constant stress, of having an animal that's not feeling good. And very often they actually have the same symptoms as the animals or the same diseases. So it's really important to address that aspect, find a little more peace and be able to relax. But again, it comes back to the gut, because with Galen, the owner sent me a message saying, I've been thinking about all he went through and how calm and happy he is now. Do you believe the extremely wild, destructive behavior he demonstrated, along with all his digestive issues, was caused by his imbalanced biome? My answer was yes to that. So we need to kind of look at all the different things. All right, another one here is Nico. Just didn't want to exclude all the cats here for all the cat people here. So this was Nico before. He had not a very good quality of life. He had sores all over his body. He had inflamed ears. He was in pain, and we tried everything that we could through conventional medicine. So he had recurrent bouts of acute pancreatitis, which is very painful and requires hospitalization. If what you were offering wasn't going to fix him, I didn't think anything would. He has responded so well. He has no sores on his body. His ears are so much better. He's playing. He's normal. He's doing really, really well. The whole program has really been helpful for everybody. Thank you. So happy cat. So we want to put all the pieces together because, as Aristotle says, the whole is greater than the sum of its parts. And that is very true when it comes to healing. So something for you to consider if you want to learn about health. It's a bit like learning to fly a plane. Would you do this on your own by watching a video or by just reading a book about it or consulting some Facebook people? I surely hope not, because that would be a little damaging to everybody. But the same is really true for healing. And as a doctor, it is my duty to teach, because doctor means teacher in Latin. So that's really what I need to do to help the healing to be easier for you and faster, because as a mentor, I can help you with that. And even though I had a healthy upbringing and I thought I was doing everything right, I got sick. And it took me about 10 years to heal. And if I knew then what I know now, it would have taken a lot less time, and I would have not spent tens of thousands of dollars and done a ton of research. You know, I want to help you, because your animals don't really have the luxury of time, especially nowadays. And your pets really do need a solution now. So this is not just a theory. Until now, I only shared the system with my one-on-one patients like Gayla and Tiny and Nico. And I have tested this entire system and proven its result with my own body and many of my animal patients. So at this point, with the increased need for support and also significant veterinary shortage, especially in the holistic area, I know that I can make a greater impact by sharing this system with people, which is why I'm here today. So this method is time-tested and proven. And to this day, I'm using this method in my own practice, and I also use it for myself. So if you're thinking, I'm ready, where do I start? All you have to do is commit and take action, which you've already done by taking so much time out of your day to be here. And thank you, all of you, for hanging in there. I know I'm kind of going a little overtime here. Too much to talk about. So anyways, I gave you a small little peek into the entire holistic pet health and longevity strategy, but I'm sure you can imagine this is just the tip of the iceberg when it comes to taking action for your furry companions' health, and to take them to a different level and optimize their body's function and prevent disease by implementing the 7 pillars of health. So you have 2 options. You can either do it yourself and make your brain smoke and do a ton of research and take years to get to where the shortcut could take you, which is the proven path of success that I have used in my practice. So why is it important to take a bit of a quicker path? Well, some of the issues that I see in the holistic animal health space is that there's so much information out there, and each place is only teaching a little piece of the puzzle that's essential to creating this greater health for your animals. And many people struggle with how to integrate that holistic medicine with conventional veterinary advice and how to communicate with their veterinarians effectively. And not having a clear plan and getting advice from different Facebook groups and lay people, for example, can be extremely confusing because everybody will have a different opinion. And only addressing one pillar of health is also like trying to build a house with only one wall. That can really never be a house. So you have to have this whole system. And trying to manage symptoms with natural remedies, which is only marginally better than using conventional medicine, is also a problem because it's still not addressing the underlying cause. So we want to find that underlying cause. And I want you to have the best possible launch pad for a healthy and happy life with your beloved companions, because I've been through it. I'm coming at this with years of experience and experimenting and finding the things that actually work versus just using short-term trends here and there. So here are just a few people who commented on my program. They're in my program. Mary says, learned so much. Thank you. This program is priceless. Dr. Suter, you're a gift to us who want to do the very best for our four-legged loves. Thank you for sharing your wealth of knowledge with all of us. I, for one, will be forever grateful for you. If you are on the fence about joining the Holistic Pet Health and Longevity Program, jump off that fence and sharpen your pencil. You are in for an informative ride. We have such a wonderful group, like-minded pet parents from all over the globe. Dr. Suter takes hard topics and breaks them down so you can easily understand them, and she makes them fun too. The Q&A sessions are so informative too. I'm so glad I took the leap. Our pup's vitality has truly improved since taking this course. You have everything to gain. Enjoy. And Michelle here says, I've seen multiple improvements in my pack since starting the program. Digestive issues have resolved, seasonal allergy issues are under control, and overall my dogs are a lot healthier. It has been such a wonderful experience to find like-minded people to share ideas and information with, and to have a safe space to ask questions and have discussions. I love the Q&A sessions and always learn something new from the other community members' questions. Most of all, the guidance and support from Dr. Suter has been invaluable, and I'm incredibly grateful to have found her and this program. This program has been life-changing for me. So that's just really heartwarming, because that's really the goal of all of this, is to change your lives. So my dream pet parent that I love to work with wants to do everything in their power to maximize their animal's health. They take action and they make changes. They're a student at heart and they enjoy learning. They also understand that this is an investment in their pet's health. And they love to be part of a caring and loving tribe and support others in their journey. And they're also good at keeping me on my toes. So are you next? Raise your hand if that's what you're looking for, because I want to sort of break open that box for you so that you can expand your knowledge and be able to do more for your animals and have a great life with them. So obviously, the better the fit, the better the results. This is really my service to the world, and I want to help pet parents who really want to learn and to change. So who is this for? It's for pet parents and then pet professionals of all sorts, breeders, health coaches, veterinarians, and vet nurses who want to branch out into the holistic arena as well. And then for pet families who are tired of watching their animals suffer and wish to learn how to create a long and healthy life for their furry companions. And also for those who understand that investing in your animal's health is the only way to truly heal and not stay stuck on the treadmill of chasing symptoms with Band-Aids. So it's for people who are action takers and are actually going to implement the information. So do you want in? Raise your hand if you do. And here's the process. Here's how it works. So you're invited to sign up for an interview to see if you're a good fit to enroll in my holistic pet health and longevity program. I've set time aside in the next 14 days to talk to you and see if I can help you. The call is approximately 45 minutes long, and the intention for me is to understand your challenges around your pet's health care and your goals for your companions, and then identify how and if I am a good fit to work with you inside of my holistic pet health and longevity program. This is a paid program. It includes education and then personal guidance from me, so you can learn how to heal your pet's digestion and their entire body and achieve optimal health. So some of the common questions that I get is, I would much rather work with you one-on-one than be in a program, how does that work, etc. So doing an online program like this is relatively new, and I know it can be a little hard to wrap your head around that and figure out how it works. But this program is also very complementary to you working with your local vet, because as vets, we never have enough time to really educate you as much as we ideally would like to. There's just not the time. And that goes for one-on-one phone consults as well. So it's the same. And with this online program, I can help fill that gap. You'll get the information that you really need in order to be empowered. And you also receive very personalized guidance on a weekly basis in the Q&A sessions that we have. So you get very personal help. I will help you to formulate a plan for your animals and support you with anything that comes up along that healing journey. You'll also have the invaluable support of a most loving community of like-minded people who are or have gone through similar situations and are already on the other end, so they can help cheer you on. So basically, in other words, you always have support at your fingertips and won't have to wait for answers. And when I started offering this type of education to my local clients, in addition to their consultations, I noticed that their animals healed much faster than those who didn't understand health and healing at the same level. Everything became a lot easier for me as well. So by you having this education and this guidance, it's a win for you, it's a win for your animals, and it's also a win for your vets. And I have one program participant she lives in the Philippines, and she has a vet there who told her that he feels so much more comfortable knowing that I am part of the team, even though we've never met or talked with each other. But so it helps to have a whole team that way, and I can be a part of that team for you and help guide you with things. And then the other question I get often, how is it different from free online webinars and YouTube videos and lives? So basically, this type of free learning that you can find only provides you with little bits and pieces. And for example, today with what I've been sharing about the microbiome and the gut in general and healing is just a tiny piece, of a whole lot more that I have to teach and would like to provide to you. So with this program, I really help to fill the gaps, and you'll get the education you really need. And you'll also receive that personalized guidance, so that you can learn to implement what you learned, so you can use what you learn and apply it to your animals. So I help guide you with that. I hope that makes sense, because what I found, again, that without having that foundation and knowing all these different things and, having the 7 pillars of health, knowing what they are and how they work and have some in-depth knowledge on those, it's really difficult to build a healthy body. It's kind of like if you're trying to build a house and you don't have the walls or the roof, then you just end up buying a whole bunch of furniture, but you have nowhere to put them. So I want you to have the house so that you can then decorate it, if that makes sense. I have to work on my analogy a little bit there. But anyway, so if you decide to work with me, nothing is held back, no missing steps. All you need to do is just follow my lead step by step. I'm on a mission to empower you to take your animal's health into your own hands and to remove the headaches and teach you the exact process to care for your animals in a truly holistic fashion that helps to optimize their body function. And that's what my holistic pet health and longevity program includes. It has an in-depth holistic pet health knowledge through an easy to follow video series. Those are pre-recorded, and through those you will gain that foundation of knowledge and learn about the step-by-step process to transform your pet's health. And then you also get weekly live Q&As with me to assist you in implementing what you learn and help you with your burning questions regarding your pet's health. And then you also get access to the like-minded, loving community of pet parents for added assistance, which I monitor. And then any added PDFs and support documents are available too. And you have lifetime access, including upgrades and bonus content, etc. And all of that is online from the comfort of your own home, no matter where you live. The program provides you with a plan and then with the assistance to help you build that house. So this is what you get. So here's the link to schedule the call with me to see if it's a fit. There are a lot of people in this masterclass, and my schedule can only handle a limited amount of calls per day, so it's best to apply now. That will allow you to start implementing the 7 pillars of health right away as well. And just something to remember, an ounce of prevention is worth a pound of cure. That's so true when it comes to health, and what you invest now will pay you back in dividends of joy, laughter, fun, and of course, health. So let's have guts and get some glory, right? So before we dive into the Q&A, here's what I know to be true. I would not be here where I am today without investing in working with people who were where I wanted to be. So again, where do you want to be in 1 year? What would you like to see? How would you like to feel? How would you like to have your animals feel? So yeah, book your call if you're interested. I would love to talk to you, and I am going to open up the Q&A now and go into the chat. But thank you so much for hanging in there. I know it's been quite a minute, so let me just go to the chat here so that I can answer some of your questions. Paulina, I'm from California. My dog has allergies to all animal proteins and very hard to switch from kibble to some other healthy cooked or raw diet. Right away, diarrhea or hot spots. Yeah, that is very common. Anytime you want to make a change in diet and an animal has a little bit of issues, that's a sign that the gut needs a little bit of help. So with the gut health program that I just mentioned and working in figuring out all the underlying causes, you can also make progress with your dog. So applying the things that we talked about here is going to help you with that. And I'm more than happy to guide you with that as well. Terry, after having a microbiome gut test, I was informed that my dog was deficient in 9 different beneficial strains of good bacteria. It was pointed out that the mother of my pup may have not had these strains to begin with, therefore not passing them on to the litter. I was told recently through another webinar that probiotics would not supply what is needed due to dying off before they reach the gut to repopulate and restore. Is a fecal transplant the only way to achieve gut health when restoring? And am I wasting money on probiotics? Thank you. You posted that quite a while ago, so I would assume that I sort of answered your question already. Yes, probiotic strains are usually not the strains that are native to the microbiome. So if you're trying to replenish the microbiome with probiotics, you're not going to achieve that. So my recommendation is to just go with the fecal transplant, either capsules or rectally, because that will give you the biggest bang for your buck. You'll see the biggest progress that way. But you have to make sure that you retest afterwards and don't just, assume that doing 1 round of fecal capsules is going to be enough. I find that a lot of animals need multiple rounds with testing in between because they have such an imbalanced microbiome, and sometimes it's hard to shift that microbiome into a healthier direction because of that imbalance that they have. So you have to just stay persistent. And a fecal transplant is basically where we take poop from a donor dog and put it into the dog that has issues. So it's basically taking poop and putting it up their butts, but there are other ways as well, doing it orally, because companies like Animal Biome, for example, they make capsules. So you can use fecal capsules as well, depending on what your situation is, because you may not have a donor dog in the area where you could use their poop for fecal transplant. So fecal capsules are a good alternative for that, for sure. And then Cash Out My Home. Hi there, Dr. Suter. My dog has had 3 fecal transplants over the course of 8 months, but the Animal Biome report shows horrible progress. She's on only cooked food and fresh veggies with plenty of probiotics, fermented foods, and goat milk and colostrum. No medications aside from insulin, but no antibiotics, vaccines, or other drugs in 8 months. Any help to understanding why the fecal transplant we've been doing at the vet are not working? Well, I don't know what the source of fecal material is to begin with, so it would depend on what the donor's microbiome is. So if you have a vet and they're not using Dr. Margot Roman's poop, for example, that would be an option to maybe enhance the microbiome that way. But I would also, in my patients, in any case, I usually recommend not giving probiotics, fermented foods, and any kind of fermented foods, because that will interfere with the fecal transplant that you just did, potentially. Because again, just like with the antibiotics, if you're giving a good fecal, if you're giving antibiotics, you decrease the microbiome, and then you're adding probiotics, then they take up space. So that may be what might have been happening with your animal, is that it may have been, the probiotics and the fermented foods, the microbes from that may have taken up space and preventing the natural, the fecal transplant to take a hold. I also don't know if ozone was used. I use ozone in my practice first to kind of decrease a little bit of the microbes in the area where I'm going to insert the microbiome, the fecal transplant. That can help as well. And then I would also check your dog for hormones, because oftentimes when they have low adrenal hormones, they will not hold on to the fecal transplant as well, because their IgA is too low, so their immunoglobulins are too low. So I highly recommend doing a little bit more exploring, and that's all things that we talk in the program as well. All right, Iva, my 11-year-old male troller has excessive heat in his stomach. Diagnosis from my now retired vet who did Chinese medicine. He's on cooling veggies and raw turkey. Still seems to have excess acid, and I give him Pepsid AC maybe 3 times a week. Suggestions on how to ease his discomfort. Again, we want to make sure that we test first and figure out what is going on. I find that a lot of these dogs that have acid reflux type of symptoms, they have an overgrowth of the Escherichia shigella group, which then that actually decreases the tone, the muscle tone of the esophageal sphincter. So that's basically the sphincter that's between the esophagus and the stomach. And so when that is a little bit loose, then acid can go back up. It's kind of like, acid reflux in humans, GERD. So I would definitely check that. And then I would also have a look at the nervous system, because I find that the stomach oftentimes can be a little stuck in the diaphragm, so rising up into the diaphragm a little bit. And that too can cause a lot of upset stomach issues. So I would definitely look further and do some more testing and maybe do some body work as well. Elizabeth, my 16-year-old Persian has an ultrasound done 2 years ago, and they can't say if she has IBD or small cell lymphoma. She has always been small, but has lost weight down to 5 pounds. Is there a way to determine if it's IBD versus lymphoma without a biopsy? And 2, what can I do to support her gut to help her absorb the food better? Thank you. Without a biopsy, you can't really know for sure. VDI has a test that will help determine a little bit whether it could be more lymphoma, or just IBD, but it's not 100% accurate. So if you want to know for sure, a biopsy would probably be it. But if there's been so much, this much weight loss, then it's probably, I would probably lean towards that. But to help her gut, working on fixing her microbiome, getting inflammatory markers down, checking if there are food sensitivities, because that would keep things inflamed. So all of the things that I talked about would be things to look at for her, and certainly to help her absorb the food better. Helping the digestive process would be to add some enzymes to help, her body break it down a little bit better. All right, Beverly, my 7-year-old pit mix grand dog is 8 months post Apoquel and Bravecto for 6 years. We are using Adored Beast products, including the probiotics and some supplements from a holistic vet, but are still dealing with yeast outbreaks on the face and the paws. What would you suggest to overcome that? We feed as good a kibble as we can, plus freeze-dried and fresh cooked, using colloidal silver, gentian violet, etc. to help. And some of it has helped a lot, but we cannot skip a day or she flares up. Yeah, so you definitely have to do the testing, look at what's going on, look at the imbalances. I would also highly recommend decreasing the amount of carbs, because that also tends to fuel inflammation in the body. So really looking at the 4R, doing the testing and looking at the 7 pillars of health, that's where you want to go. And that's also what we would talk about in the program to come up with a plan for your individual dog. But great, that you're able to keep the flare-ups, minimal, but obviously you want to reduce them completely. That would be great. And then good for you that you stopped the Apoquel and the Bravecto, of course, as well. That's really good. Sandra, my 5-year-old Labrador raw fed until a few weeks ago when she had some vomiting, mostly bile. X-ray showed gas and some inflammation in small intestine, barium, no obstruction. Waiting for an ultrasound next. Is a Nutriscan test worth it? Hasn't vomited for a week. Vomiting is random. Yes, definitely Nutriscan, and I would also do a microbiome test to see what's going on, and then work on restoring the microbiome, because it's very possible that something just kind of disrupted it a little bit. Definitely, and then checking for parasites as well. Sandra, I'm becoming empowered, always trying to learn. Oh, that's awesome. Oh, you're ready. Good. All right. Okay, I think I answered that question already. My dog Jules, 9, Carissa, has environmental allergies and food allergies. Would this help her? Yes, definitely. Yeah. You always have to look to the gut for everything, basically, whatever they have. Kim, we are having fecal transplant tomorrow with Dr. Pima at Holistic Veterinary Healing in Maryland. We have been battling major skin issues for years. Microbiome test came back not good, and we have wobblers on top of that, all that. Yeah, good for you that you found somebody who's doing the fecal transplant. That's awesome. BKG, not sure what your full name is. What about an anxious dog on 10 milligrams of fluoxetine for a year now, who is healthy, no gut issues, just a bit of a cuckoo, raw fed variety diet since adopting at 8 weeks, no vaccines, no pesticides. I definitely would check the fecal, microbiome just to see what's going on there, and also check hormones. Some dogs, they do have a little bit more behavior challenges, and some of them can benefit greatly from fixing the gut and supporting that. But some of them do need a little bit of extra help, training, etc. Chris, my dog starts pooping nicely at the same art, and then change to soft serve or diarrhea as he walks and poops more. Is that a small bowel issue? Well, that could just be that the motility of the gut is just a little bit increased. So I would want to find out, is there more stress when the dog is outside on walks? Is it really excited? But certainly looking to the gut microbiome as well, and potentially adding a little bit of soothing herbs that can certainly be helpful. Anonymous says, you state microbes in the gut. Please define gut. Are you referring to small intestine, large intestine, both? Are there different microbes in the small versus large intestine? Yes, they are a bit different, depending on where they are located. Even in different areas of the small intestine, they will be different. LZ mentioned you listed some drugs which affect the microbiome. Is this a full list of the drugs that cause the most disruption of the microbiome? No, it's not a full list. I mean, there are others, but it's definitely the main offenders. Why do dogs eat their own poop? I think I answered that. Where can one get food sensitivity tests for cats? That would be from Hemopet. They have a saliva test kit that you can send in. And then LZ, what comes first? Hormone imbalance leading to dysbiosis versus dysbiosis creating hormone imbalance? Yeah, well, that's a good question. That's the chicken or the egg question. In the end, if you have both, you treat both. Nikki, if the donor was not raw fed, would that still be considered a healthy donor for an FMT? Yes, because it seems like healthy donor dogs have similar microbiomes, no matter what they eat. So they have like the core microbes that are very similar. Me personally, because I put most of my patients on a raw diet, or not a highly processed diet in any case. I do prefer donor dog poop that has been raw fed. Can dysbiosis cause a dog to have insatiable appetite? Yes, because the microbes in the gut tell the body what they want. So if there's an overgrowth of certain microbes, there could certainly be the signaling to the brain, telling the brain that it needs to eat more. But there are other things that can also cause insatiable appetite, including hormone imbalances. All right. I know I have more questions here, but I think I'm going to let you all go. It was just so nice that you were all here and stuck around, and Thanks also to Dr. Roman. I see you answered some questions as well. Thank you for that. But yeah, thanks everyone for being here. It was just such a pleasure, and I hope I get to talk to you and help you and help your animals feel better. So have a wonderful evening, and thanks again for being here. Bye.